As an oral surgeon, you must do a lot of wisdom teeth. Have they gotten any better over the years? I mean, is it easier on people than it was before?
The horror stories that you've heard about wisdom teeth are actually not true in most of the patients that I see.
Okay.
So we do wisdom teeth all the time. And the reason we do it is because most patients just don't have enough room for that third molar or that wisdom tooth. And usually it develops at the age of about 15 to 20 or so, and it starts crowding the other teeth. It can damage the teeth in front of them. So a perfectly healthy second molar can get damaged by a wisdom tooth, and now you're having to take out a perfectly healthy tooth. And the other thing we see is infections, and we've seen some pretty bad infections from wisdom teeth. And then we have to try to emergently get the patient in and try to take out a tooth that's infected, and that's never a good idea. So that's why we like to take out wisdom teeth when there isn't there's a reason for it down the road.
And these kids are sedated? Like a little bit of IV sedation?
Exactly. So light IV sedation, they don't feel anything while we're doing it, and they wake up and their wisdom teeth are done, and they don't have to worry about it for the rest of their lives.
So if they do it on a Friday, do they have to miss school?
Yeah, so
or you just want one day off?
Yeah, usually 1 or 2 days is all that's required. It depends on how impacted the wisdom teeth are. Okay. So if they do it on a Thursday or Friday, they should be ready to go on Monday.
My question to you, like I have a 16-year-old.
Yeah.
If he has no pain and they seem to be coming in perfectly straight, I mean, does everybody need their wisdom teeth taken out?
No, they don't. So that's why we have to evaluate the wisdom teeth at the appropriate age. And if there's enough room in the jaw for the teeth to come out and be cleanable and are otherwise healthy, then you can certainly leave the wisdom teeth in.
But for the most part, it's not a good thing to keep them.
Most people don't have enough room, and that's why we
like
to take them out.
And it'll cause like them to have crooked teeth?
It can. It can push on the other teeth, and you can have issues with crowding and other changes in the shape of your smile.
Okay, so now why go to an oral surgeon for your wisdom teeth over a general dentist? And they're doing more and more of these.
Sure. So we specialize in surgery of the mouth. So we do this on a daily basis, while others may do it once a week, once a month. We do it on a daily basis. So we've got the technique down perfectly so that the complication rate goes down.